The specialty that I bring to the practice is low vision. I was always interested in low vision, so after school I went and did a residency at a VA in West Haven in Connecticut. They have a very large blind rehab center there, so we not only did low vision exams, but the patients would actually stay there for a couple of weeks and go through blind rehab. They would do mobility, living skills, computer work, all kinds of things that we got to learn and kind of teach the patients from scratch, really everything. So it was a really great learning experience. The residency program was a year commitment. I did it right out of optometry school. I knew that I always wanted to do that because it would open more doors for me in a lot of different areas. And again, I always liked low vision, so I wanted to have the specialty in that, and I knew that to separate myself, I would have to really have a higher education, not just what I learned in regular, during the regular 4 years. In my residency, I definitely saw a high volume of patients and, really interesting patients too. I did half primary care and half low vision, but even in primary care, you see, it's not your average patient. You see a lot of different situations, a lot of different disease, and so you really learn a lot. In low vision, because we got patients from all over the country, it was always a very full schedule, which is not always easy to do in all situations with low vision. I've been at the practice here for about 5 years. It's a multi-doctor private practice. We all kind of have our specialty here. I'm really lucky to be able to do as much private practice low vision as I do. It's not always the easiest thing to get set up, but we have really good relationships with the doctors around us, especially the retina doctors, because you do tend to see a lot of macular degeneration and that kind of thing. We also have a very good relationship with the state, the Commission for the Blind, a lot of charity, Helen Keller, the Jewish Guild for the Blind. We keep all those relationships, at the forefront. That's really important to us. Being a low vision optometrist, you're kind of in a different position where you do have time to spend with the patient and time for education, and it's interesting to see patients will come in and they might know a little bit about the disease, but they don't necessarily know a lot about how it's affecting their vision. And so it takes a good amount of education to sort of explain the eye disease to them more thoroughly and explain exactly how that's affecting their vision. And that's really important, because once they understand that, you can kind of segue into how do you best use the vision that you have. Where can we go from there? What kind of devices are going to help you the most, and what's realistic expectations with the type of vision that they have. Low vision is a specialty where you really need to have a lot of compassion for patients. You have to realize that a lot of them come in with they don't really know what their expectation is, so you kind of have to educate them on everything and give them realistic expectations, and at the same time be really compassionate and realize that that it's a loss for them and it can be devastating. And unfortunately, in some of the worst case scenarios, when patients don't know what to expect, you are the one that has to tell them, no, we're not going to be able to make your vision much better than this, but let's look at what we can do with the vision that you do have. Let's look at quality of life issues. Maybe you're not going to use your vision the way you used to use it, but let's help you get through your day and be able to still live your life the way you want to.